Let's talk about cesareans. A cesarean occurs when the care provider makes an incision over the lower segment of the uterus to access the baby. The World Health Organization says that the cesarean rate should be around 15%. Yet in the United States, the cesarean rate is about 33%. The need for a cesarean is often quite low, as genuine maternal pathology is rare. Yet there are certain circumstances where a cesarean is absolutely necessary and can be life-saving to both the birthing person and the baby. There are many different reasons why cesarean rates are higher than they actually should be. This may be due to financial incentive, convenience, or high rates of interventions at the beginning of the labor process or to start the labor process, which all may increase the risk of cesarean. We'll talk more about how to decrease your risk of cesarean in this course, and you can learn more about cesarean in the cesarean module. Let's talk about the benefits. For people who have a cesarean, there is a reduced rate of urinary incontinence postpartum. There is a reduced rate of pelvic organ prolapse. There is no risk of trauma to the newborn due to an instrumental delivery, such as a forceps or vacuum delivery. And it may be life-saving to both the birthing person or mother and the baby. Let's talk about the risks. There is an increased risk for uterine rupture in subsequent pregnancies. There is also an increased risk for scarring along the uterine wall, which can cause placenta implantation abnormalities in future pregnancies. There is an increased risk for infection. There is an increased level of blood loss in a cesarean in comparison to a vaginal birth. There is an increased risk for blood clotting. There is a risk for side effects from particular pain medications, such as headaches or nerve damage from anesthesia. There is a risk for surgical injury, and there is an increased risk of the newborn being separated from the person birthing after birth. Skin-to-skin post-cesarean is very important. And the research that we have on skin-to-skin shows that skin-to-skin post-birth actually increases a newborn's will to live. Denying skin-to-skin increases infant mortality rates. So sick babies and premature babies do better when they are given skin-to-skin contact. Incorporating skin-to-skin in the operating room, though, is a little tricky. Not because it's too much to ask. It's just that hospital policies are hard to budge, and it requires a little more effort on the side of the hospital. They need to have another person in the room to support skin-to-skin contact. And there are still plenty of stigmas and myths around skin-to-skin post-cesarean that many care providers still believe. If you do have a cesarean, know that you can advocate for delayed cord clamping, skin-to-skin after birth, and more.